So, any questions about what it was like to do strategic planning or what the steps are or things that have come up while you've been working on starting to strategic plan?
I have your main data source that
CHICS, California Healthy Kids Survey.
It always comes out with something different, so that's why. It's like I'm a little bit envious because it's like, dang, that is specific. It's for Humboldt County, and I think our data sources are a lot more vague, you know, and they don't come out as frequently, and so it makes the strategic planning process a little more challenging.
So I don't know if the microphone can hear the question, but it was about having challenging or vague or not as frequent data sources.
Yeah.
So, and I will say that there are data indicators in the CHICS that would be relevant to your program, such as the amount of fruit and vegetables eaten.
And that's weird. I didn't see fruit and vegetable. I saw how frequently breakfast.
Maybe it was breakfast, but there are. So one thing that I thought was really great at our training that they brought up, which is that you could spend all your time looking for the perfect data source. You want to find what's available and use that. So maybe if breakfast is not like the perfect thing, but it is more frequent, that might be a good data point to use, or something around physical activity. And I remember being in an evaluation training where they said perfect is the enemy of good. And I really feel that way with program planning, that you could spend all your time wanting the perfect program plan, but you just got to work with what you have and move forward, because it's important to get as good a picture as possible at that time. But yeah, we don't always have perfect data for Humboldt County. So.
And I don't know if I'm heard on that, but like my stigma against people with mental illness, like how do you measure that? That's a field that's in its infancy, and measurements for that have just started to be put out in the last few years at the top, like at universities, and so that's where qualitative data is going to be filling in the gaps, and I think that's something that some of our programs are going to be relying on.
Yeah, we are really, really fortunate to have the CHICS data. So I really value that. But we did look at other indicators like Ron's alcohol and other drug death review, where he looks at, every year pulls coroner reports on specific alcohol and drug-related deaths. So that wasn't the only source we looked at. We did also look at other sources. And that's the other thing is, Ron, if you haven't talked to him yet, is a really good resource for thinking of where to find information like that. We probably do have pretty good numbers for the estimated percentage of people with diabetes or prediabetes, or maybe even youth with that.
Yeah, I think most of our data comes from the CHIS data, and there's like soda consumption and fruit and vegetable consumption, so we have to noodle through that.
So, but yeah, that's a good question. We don't all have like such a great data source.
I know, a little envious, but that's
I know.
okay. That's okay.
And they are open to us adding different questions in the future. So if there are specific questions you want to ask, you could talk to Grace Rosnahan, who has worked with CHICS to have us add different questions before. So there might be specific questions you could ask them to add for the future, or things that you're interested.
Do they go into the high schools?
They survey all the schools that participate. So we have a Humboldt County report, and then we have other reports just by different schools. And those are all stored in the share drive. I can send out the link to where it is. I think it's an AOD under CHICS, California Healthy Kids Survey. So it is broken up by the different schools, which is valuable too. And we find that when we go into schools, it can be useful to show them a breakdown of how their school compares to the rest of the county or the state. And that's one thing I meant to add, was that data can be a really great way to engage your community members in an issue. I found that with our prescription medication efforts, people at every level of that issue appreciate seeing local data. So Sean and I have done presentations at the Alcohol Drug Care Services where we talked about the local data related to overdose to people who are in rehab, and it helped them engage more with the issue, or differently. I think people appreciate seeing the local picture and knowing how they fit into that, and I think data is really important for engaging community members and making sure everyone's on the same page with understanding issues, because people can have a perception about something, and that's certainly very valuable, but it's also important that everyone is familiar with the basic indicators for the topic you're talking about, so that we can all address the issue from the same starting point. So I have been, I guess, surprised and happy to see how much people respond to sharing of local data around health issues. People really, healthcare providers want it, people affected by the issue want it, law enforcement wants it, and it's not something they always have access to or are that aware of. Law enforcement doesn't always know how overdose looks. They just see, individuals. So for nutrition, I'm sure there's providers would love to see the larger things with their diabetes rates or fruit and vegetable consumption or soda consumption. I think that's a place where public health really has a lot to offer, is in sharing the whole picture, which I don't think other community members always get to see. Other questions?
Or frustrations.
Or frustrations,
It's like a
challenges,
safe
yeah.
place for you to say if it might be on your mind. I'm super frustrated that I've been asked to do this, and these are my concerns surrounding data, and I'm worried about X, Y, Z in terms of trying to get my hands on specific information. It's okay to say that now because you'll help the people who might not be in the room hear the answer to that question. It's okay to be having those feelings. It's a natural part of the process.
And I will say for some programs, like our plan, which now that it's approved, I'm very happy to share. I'll send a PDF of it. For smaller programs, it doesn't necessarily have to be a big, huge, long plan. Ours ended up being 30 pages, but a lot of that is like these logic models or different tables. And if you see it, it's not that overwhelming. And we tried to write it so that it would be accessible to community members. It's a great way for community members to understand why we're doing what we're doing and why we pick the activities and priorities that we do, and to be able to be really transparent about our work to the public and to our coalition members and things like that. Taxpayers. But for like a smaller program, you could have like a 6-page plan that just has your key data points, why you're choosing to do certain activities, and just a nice summary. And it's just a good starting point to have. I think it really helps with any kind of transition from different employees, so that you can say, here's the explanation of why we're doing what we're doing. Here's a good starting point. Here's our plan. What kind of things do you like on this, or what do you want to work on, or what are you curious about? And it helps with continuity of programs across time, I think. Questions, concerns? Ready to move on to someone else? And you can always come talk to me in my office. You know where it is. If you feel like, oh, I don't know what to do with this. I'm not as expert on this as our TA consultant, Charlie Seltzer, but I have now done a strategic plan. I had a strategic plan for our hepatitis C work in Vermont. I have some experience with it and can help brainstorm. And someone today will be trying to brainstorm indicators for different programs. So it's not so scary. It's really logical. It just takes a different type of thinking and maybe more big picture than we're used to doing. It's really like a long-term thing of like, what do we want to see? Where do we want to be in 5 years? What are goals for where we want our community to be in the specific area? Good time to imagine and be creative and really think outside the box and think about what we would ideally like to do and not just what we're constrained to do by our funding.